Our lifestyle habits are powerful medicine that can help us prevent, control, and combat diabetes, high blood pressure, high cholesterol, heart diseases, and other lifestyle-related chronic diseases. So let's use it. Let's encourage one another to unlock the power of our lifestyle habits, whether it is our sleep habits, our exercise habits, our dietary habits, our stress management habits. They can all be powerful medicine. Powerful medicine that can help us prevent, can help us control, can help us combat all these conditions. So can we encourage one another? Right, let's do it. Right, let's encourage one another to practice seemingly simple lifestyle that when they compound together with other healthy habits, when they compound over time, can be powerful medicine. How many of you believe in that? How many of you believe that healthy lifestyle, not just healthy lifestyle, targeted, carefully selected lifestyle choices can help us in such powerful ways? Hi, I'm Dr. Chan. I'm a medical doctor. I'm a medical doctor from Singapore. And I want to encourage you to practice simple things like going for a walk every single morning. How many of you have a habit of going for a walk every morning? So if you have not planned for a walk today, you have not gone for your walk today, can I encourage you to plan to do so sometime today? Doesn't matter whether it's a long walk, a short walk, a fast walk, a brisk walk, a slow walk, doesn't really matter. Make it a routine. Make it a part of your life. Make it something that you do consistently. The key to unlocking the power of lifestyle as medicine to combat chronic lifestyle diseases is consistency. The consistency of what we do every day, every meal, is what makes it so powerful. Don't underestimate the compounding power of consistency over a period of time. So many people will think that, hey, go for a morning walk every day, no big deal. Sup sui lah, not very vigorous, not very intensive, perhaps therefore not very helpful. But we forget to account for the compounding power, right, of such practice that's done consistently over time. Hello, good morning, good morning. 早晨，大家早上好. Selamat pagi. So let's walk. Let's encourage one another to walk. 1 in 3 persons in Singapore are at risk of developing diabetes in a lifetime. 1 in 3 persons in Singapore, even around the world, are often succumbing to cardiovascular disease. 1 in 3 deaths are due to cardiovascular disease in Singapore and many places around the world. So can I encourage you to not take that as an inevitable given outcome of aging? It need not be this way. It should not be this way. And there's something we can do about it, and that is our lifestyle. We can and we should unlock the power of lifestyle to do our best. We cannot guarantee that we can prevent diabetes, heart attack, stroke. We cannot. No, in the only thing in life that we cannot be 100% sure and guarantee is the prevention of disease. Sometimes certain things are not within our control, but we certainly can minimize the risk to a large extent. So let's do it. Let's encourage one another to do that. Okay? Yeah? How many of you go for a walk in the morning? How many of you go for a walk in the evening? What's your favorite time of the day to go for your walk? For me, my preferred time of walking is morning, because I'll be killing 2 birds in 1 stone, right? Killing 2 birds with 1 stone. I go for my morning walk, get some physical activity in, and I get the early morning sun consistently, early in the morning. And that is going to be very powerful in helping us to keep our body clock healthy. The circadian rhythm, the circadian clock, that help to keep our body physiological function, well balanced, well harmonized, right? In our body literally work like clockwork. Our body does have a sense of when it is night, when it is day, but sometimes our lifestyle will make our body clock go a bit haywire, go a little bit, not well balanced. So one of the key things that we should do, we should be mindful about, is looking after our body clock. And one of the ways, easy, powerful ways to do that is to go for a morning walk every single morning. Yeah, the exposure to early morning sun is not just about vitamin D and getting some benefits from the sun. It is about helping us set our body clock, strengthen our body clock, our circadian rhythm. Yeah, why so important about circadian rhythm or circadian clock? It actually affects many aspects of our body functions, physiology, including glucose metabolism, including our ability to handle glucose or handle sugar. Okay? So let me encourage you to unlock the power of your lifestyle choices to prevent, to combat, to control diabetes, high blood pressure, high cholesterol, cardiovascular disease. And as I always would do every opportunity that I get, I want to highlight to people about this, that if you have diabetes, I can encourage you that there is a potential of reversing it. Not guarantee, but the potential. There's a possibility, provided targeted, appropriate, adequate, sustained lifestyle and eating habits changes and improvement are made early enough, adequately, appropriately, and sustainably. And the key operative word here is early enough. The longer that one waits before making the attempt to reverse the diabetes, the lower the chances of success. The earlier in the diabetes journey, the first year, the first couple of years, the first few years after being diagnosed with diabetes, and you have a good goal at overhauling, in reviewing, in improving, in changing your lifestyle eating habits, the higher a chance that you can get in successfully reversing your diabetes. That's the message I want to send to every person with type 2 diabetes. Because from my experience conducting training programs, coaching programs, whether in groups or one-to-one setting, the sad reality is that the vast majority, more than 90% of people with diabetes do not know, let alone believe or do. The majority of people with type 2 diabetes do not know about the possibility of reversing their diabetes. So for the year of 2026, I have set myself a New Year resolution, a goal. My goal is to reach out to as many people with type 2 diabetes as possible, shout as loud as I am able to do, to highlight to them that there is a possibility, there is a potential, the encouraging news, information that there is a possibility of reversing the diabetes. A person with type 2 diabetes need not just be a passive sufferer, that, oh, can't be helped, I have diabetes, just have to live with it. But the earlier that you make the decision to have a good goal at improving your lifestyle, including your habits, the better a chance that you will have in reversing it. What does reversing diabetes mean? Reversing diabetes means that a person with type 2 diabetes started on medication to control the blood sugar, but after a period of lifestyle and diet adjustment, the sugar control becomes better and better and is able to reduce and eventually get off the medication and still able to achieve good blood sugar levels without any glucose lowering agents, without any medication, and yet maintain a reasonably good, there's of course a medical criteria for it, right? A good blood sugar level for at least 3 months. That's diabetes reversal. That's diabetes remission. A lot of people have this wrong idea. When it comes to diabetes, 一开始服药就一辈子服药. That's not always true. It's only true when the window to reverse the diabetes is closed. Because the further down the road after a diabetes diagnosis, before one take the concerted effort to 彻底的 to comprehensively review and improve all aspects of his or her lifestyle. If we fail to do that early enough, the damage to the various systems in our body that are critical for regulating blood glucose, they become damaged beyond the level that you can reverse. Yeah, I'm simplifying it, even at the risk of oversimplification. But the point is, type 2 diabetes has the possibility of reversal, provided lifestyle and eating habits are changed and improved early enough, adequately, appropriately, and sustainably. Okay, that's my message. So share this message with every person with type 2 diabetes that you know. But not just diabetes, but other conditions such as high blood pressure, high cholesterol, cardiovascular disease. Lifestyle can be powerful medicine. How many of you would agree that lifestyle is powerful medicine? How many of you practice lifestyle as medicine? Which aspect of your lifestyle do you think you have room for improvement? Which aspect of your diet do you obviously know and see there's room for improvement? Then work on it. Don't be passive about it. Don't be complacent about it. And it need not be a struggle. You need not be striving. Thrive, don't strive. Because changing of habits, changing of diet, of course, is not going to be easy, especially at the beginning. But can I assure you, from my more than 10 years of coaching people to change their lifestyle, especially change their diet, I am confident that if one persists in the change in their diet, it will get easier and easier and easier over time. That not only over time, that the new dietary habit will become easier, but it may even become more enjoyable. And that helps with the sustainability. Okay? So let me encourage you, right, to look at your lifestyle as medicine. And don't just know it, do it. Knowledge itself does not give us health. Only action will. Right? So please encourage one another. Take the first baby step. Simple things like going for a walk every morning can be powerful, powerful medicine. Okay. Choose better, get better, eat well, be well.